Hello everyone, my name is Pasquale Esposito and I am a graduate student at the University of Ottawa. Before I go into details about this presentation, I think it's important that you all know what my background is and what my research really consists of at the moment. Presently, our lab really concentrates on the interactions between stress and the gut microbiome and how this can affect the pubertal brain and evidently mental health later on in life. So, more specifically, we induce stress in pubertal mice and we want to see what the effects of specific stressors are on the gut microbiome and how this could affect these pubertal mice when they reach adulthood. For today's presentation, I will be broadly presenting the effects of pubertal stress on mental health. This is an especially relevant topic in the circumstances that we're currently living in with COVID-19. COVID-19 is a stressor in of itself, and it's important to know how stress in general can affect the pubertal brain and what the risk factors really are and how this can affect mental health later on in life. So, without further ado, before I go into great detail about specific things of stress in this presentation, I think it's important that you all know what stress is exactly. So, stress can be defined as any type of change that causes physical, emotional, or psychological strain. Stress is your body's response to anything that requires attention or action. During stress, we experience perturbations of homeostasis. So, homeostasis, just to tell you all what exactly that is, homeostasis is a property of cells, tissues, and organisms that allow the maintenance and regulation of the stability and constancy needed to function properly. So, during stressful circumstances, we experience changes in our body's ability to maintain this stability and constancy. Everyone experiences stress to some degree. Stress responses help your body adjust to new situations. Stress can be positive, keeping us alert, motivated, and ready to avoid danger, but stress becomes a problem when stressors continue without relief or periods of relaxation. The way we respond to stress can have a profound impact on our well being. Some people may cope with stress more effectively and recover from stressful events more quickly than others, while some people may need assistance when they encounter stressful events. Examples of stress include things such as routine stress, which is related to the pressures of school, work, family, and other daily responsibilities. There can also be stress brought about by sudden negative change, such as losing a job, a divorce, or an illness. And there can also be traumatic stress, which is experienced during an event such as a major accident, a war, assault, or natural disaster, where people may be in danger of being seriously hurt or killed. People who experience traumatic stress may have very distressing, temporary emotional and physical symptoms, but most recover naturally soon after. I would also like to really emphasize that not all stress is bad. In a dangerous situation, stress signals the body to prepare to face a threat or flee to safety. In these situations, your pulse quickens, you breathe faster, your muscles tense, and your brain uses more oxygen and increases activity. These are all functions aimed at survival and in response to stress. In non-life threatening situations, stress can motivate people, such as when they need to take a test or interview for a new job. So although stress is something we need to be aware of, it is also something that helps us in our day-to-day lives. Another aspect of stress that is important to be aware about is what exactly are the signs of stress. The body's autonomic nervous system controls your heart rate, your breathing, vision changes, and much, much more. Its built-in stress response, the famous fight or flight response, helps the body face stressful situations. When a person has long-term chronic stress, continued activation of the stress response causes wear and tear on the body, and physical and emotional symptoms can develop thereafter. So, what exactly could be some physical symptoms in response to stress? These can include things such as aches and pains, trouble sleeping, you develop headaches, dizziness, and or shaking. You can have a weak immune system. and you can also have high blood pressure. It is important to keep in mind as well that this is not an exhaustive list. It's just to give you all an idea of what exactly stress can cause. Okay. In addition to these physical symptoms, there is also emotional symptoms, which include things such as anxiety, depression, and panic attacks. So as we can see, stress has far-reaching effects. It can really affect different aspects of our life. It may not directly impact us, but it could affect certain functions in our body, which can then cause things such as anxiety and depression, for example. It is also important to note that stress is subjective, which means that it's not measurable with tests. Only the person experiencing it can determine whether it is present and how severe it feels. So if you feel like you are overly stressed, do not be afraid to seek out help, right? So stress and its effects are subjective as well. It depends how you perceive the stressor and how you plan on dealing with the stressor. Okay, so another thing that I would like to touch on is how exactly are the children today being affected by stress, and specifically in Canada. A comprehensive new report from UNICEF Canada asked how children and their lives are going right now. The results show that Canada is a tough place to grow up in at the moment. 55% of children report a high level of life satisfaction, right? So this might seem like a large percentage, but keep in mind that these are children, and almost half of them are not reporting that they have a high level of life satisfaction. So this is a problem in of itself. 27% of these children report feeling sad or hopeless. 27% report being bullied, and 28% get into fights. Right? So being bullied and getting into fights is a stressor in of itself and affects things such as life satisfaction. 43% feel supported by their teachers. 17% feel overwhelmed with schoolwork. And 21% engage in play or unstructured activity per day. So a point that I would really like to highlight is especially that last point, where 21% engage in play or unstructured activity per day. This is a big problem in of itself. Children should be playing quite a bit, and increasing activity is really good in dealing with stress, and it has a tendency of reducing stress, and especially in children. In general, these statistics are alarming, as childhood is supposed to be a time of joy and excitement, but it seems like children in Canada today are not having this experience. Furthermore, these negative childhood experiences not only affect children presently, but they also have the potential to affect their mental health for years to come. Our early life experiences have a profound impact on our future functioning, and as such, it is essential that children are provided with the best experiences possible so that they can live healthy and happy lives. So another definition that I would like to go through with you guys is the difference between acute and chronic stress. When talking about acute stress, this is stress resulting from specific events or situations that involve novelty, unpredictability, a threat to the ego, and it leaves us with a poor sense of control. This on-the-spot type of stress can be good for you because the stress hormones released help your mind and body to deal with the situation. So an example of acute stress can be things such as almost getting into a car accident or giving a speech in front of people. You feel your heartbeat in your throat, you become hyper aware of everything around you, and feel pumped. These are signs that your stress hormones are hard at work. In terms of chronic stress, this is stress resulting from repeated exposure to situations that lead to the release of stress hormones. This type of stress can cause wear and tear on your mind and body. Many scientists think that our stress response system was not designed to be constantly activated. This overuse may contribute to the breakdown of many bodily systems. In fact, chronic stress has been linked to heart disease, high blood pressure, high cholesterol, type 2 diabetes, and depression. But the effects of chronic stress can also be specifically damaging to individuals at a sensitive period of development, such as children in puberty. So to go into a little bit more detail about this, let's discuss why acute stress is considered good and chronic stress is considered bad. Before we do this, if we really want to understand why acute stress is good and chronic stress is bad, we must understand our stress response. In this picture, we have a depiction of our stress response. This is the hypothalamic pituitary adrenal axis, or HPA axis as it is more commonly referred as. This HPA axis is our stress response. When we experience stress, this sends signals to our hypothalamus, which then sends signals to the pituitary, and the pituitary then sends signals to the adrenal cortex. The final product of all of this, after this cascade of signals and hormones that are released, is cortisol. Cortisol is our primary stress hormone. It is what keeps us aware, motivated, and keeps us away from danger. It is good in acute short-term periods of time. So when we experience acute stress, this system is activated and cortisol levels are raised, but they are soon after returned back to normal levels, which is good. But when we experience chronic stress, the system is activated once again, but for an enduring period of time. And this results in cortisol levels being increased for a chronic period, for a very long-term period. And having high levels of cortisol for long periods of time can have seriously damaging effects on our body. The body is good at handling episodes of acute stress. It is the most common stressor that we experience in our day-to-day lives. We are designed to recover quickly from short-term stress. That's how many mental health experts define resilience, how quickly you recover from an acute episode of stress. Your blood pressure, heart rate, breathing rate, and levels of muscle tension may skyrocket for a short while, but they will return back to normal. If you're young and or healthy and in good shape, these markers of stress once again will return back to normal levels. However, the body isn't so good at handling chronic stress. Over time, chronic stress gradually increases your resting heart rate, blood pressure, breathing rate, and levels of muscle tension, so the body now has to work even harder when it's at rest to keep you functioning normally. In other words, chronic stress creates a new normal inside your body, and this new normal can eventually lead to a host of health problems, including high blood pressure, heart disease, chronic pain, and depression. And once again, this is specifically relevant for pubertal individuals as they are in a sensitive period of development. Many aspects of themselves are still developing, and if they experience chronic stress, this increase of cortisol for long periods of time can have really damaging effects on them in the present and in the future. So going into more detail about chronic stress, and more specifically, the effects that chronic stress and this chronic increase of cortisol can have on our brains. One of the main things that this increase of cortisol and chronic stress can have on our brains is that it can cause atrophy. And what I mean by atrophy is that we are having a loss of neurons and neuronal volume as a result of stressful life experiences. So you are losing the main things that control how we function, control how we think, and control how we go through our day-to-day lives. So more specifically, when we experience stressful life experiences, we can experience atrophy in the hippocampus and prefrontal cortex. So the hippocampus and prefrontal cortex are brain regions that are really involved in a variety of different things. If we concentrate on the hippocampus, for example, one of the main things that the hippocampus helps us with is our memory. One of the main diseases that is related to the hippocampus is Alzheimer's disease, and for this exact reason, people who experience Alzheimer's usually have atrophy in this region of the brain. So when we experience stress, this in itself could cause atrophy, and one can think that it could also make you more susceptible to diseases such as Alzheimer's, and it could affect your memory. Another brain region that is highly important is the prefrontal cortex. If we experience atrophy in the prefrontal cortex, this could lead to a whole variety of problems. The prefrontal cortex is pretty much involved in everything. It can be involved in focusing our attention, in predicting the consequences of one's action, anticipating events in the environment, impulse control, managing emotional reactions, planning for the future, right? So the prefrontal cortex is really involved in a variety of different things. And if we experience atrophy in the prefrontal cortex, we are losing the ability to do all of these things, right? We lose the ability for proper impulse control. We lose the ability to manage our emotions effectively or to plan for the future. And this in itself can lead to a whole host of mental health problems, right? If you have a disability in terms of managing your emotional reactions, this can lead to problems such as depression and anxiety, right? An inability to plan for your future can cause a whole host of problems as well. For example, drug addiction. Drug addiction is highly involved in the lack of ability to plan for your future. You're not thinking about your future. So if you experience stress, this can lead to these problems in the prefrontal cortex. Another brain region that can cause problems when you experience stress is the amygdala. The amygdala is our primary emotional center, right? And specifically in the amygdala, we can experience hypertrophy. So this is the complete opposite of atrophy. It is an increase of neurons, an increase of functionality in the amygdala. This might seem good, but an increase of activity in the amygdala, which is our emotional center, can lead to a whole host of problems. The amygdala, when it is hyperactive, it can lead to disorders such as depression and anxiety because we have an overactive emotional center, right? So, evidently, chronic stress has the potential to have a devastating impact on our functioning. And we especially need to think about this about pubertal individuals as their brains are really in the midst of developing. So if they experience atrophy or if they experience hypertrophy in the amygdala, for example, or in the hippocampus or in the prefrontal cortex, this can not only lead to problems in their present state, but it could also lead to problems in the future. So I've been talking about puberty quite a bit, and I also think that it's important to really define exactly what pubertal development is. And essentially, what puberty is that it's a period during which sexual maturity is attained. There are a various levels of circulating gonadal hormones such as estrogen and testosterone that are changing in these pubertal bodies, which are causing various changes and various aspects of their bodies and mind to develop. It is accompanied by numerous changes that can have an impact on behavior later in life. So, as I've been saying repeatedly during this presentation, it is a very sensitive period of development, and a lot of changes are happening in both the body and brain. And if things such as stressors are experienced, chronic stressors more specifically, this can really affect the direction that these changes will go, and it could really affect their behavior later in life. It is a period of significant brain reorganization. We are getting new neurons, new connections. There are various things that are changing in the brain. And when we experience stressors, this can negatively affect this brain reorganization, which can subsequently make these individuals more susceptible to diseases and mental health problems such as anxiety and depression later in life. So with all of this being said, it is now time to turn to what exactly the research is telling us about the effects of pubertal stress on the developing brain and how this can affect mental health later on in life. For this point of the presentation, I will be presenting a research study that our lab actually did where we examined the effects that stress had on pubertal mice and how this pubertal stressor really affected the mice when they reached adulthood. So to give you guys a little timeline of what was done in our study, mice were shipped to our lab at 3 weeks of age, which is an age that has been shown to be relatively resistant to shipping stress. So we want to avoid different types of stressors. We want to concentrate on the stressor that we ourselves want to induce in the mice, right? So avoiding shipping stress was very important as well. Mice can experience stress simply by just being moved to the lab. We then let them acclimate and injected them with either saline or LPS at 6 weeks of age. which our lab and others have shown to be a stress-sensitive period of puberty, right? So 6 weeks of age is a stress-sensitive period. And when I discuss LPS, this is basically lipopolysaccharide. This is a bacterial infection that we inject into the mice, and it is considered a chronic stressor because it induces sickness behaviors for up to 48 hours. So it's enduring, and it really causes an enduring stressor on the mice. Then following this LPS injection, we let the mice reach adulthood, which is 10 weeks of age, and we then ran a battery of behavioral tests to see if it affected their mental health in any way. I will go into more detail about these behavioral tests relatively soon. So the first behavioral test is the forced swim test. The forced swim test is used to examine depression. It is considered to be a valid test in the literature. It mainly consists of filling up a large beaker with water and placing the mouse in the beaker. Mice will swim or try to escape the water, but they will eventually give up and float. And it's this giving up, the immobility, that we are interested in examining because immobility equals behavioral despair. It is the idea that when the mice give up, they are basically just entirely giving up, and it is behavioral despair. And this is a behavior that is seen quite often in individuals who experience depression. They basically just give up, and there is behavioral despair. So this is what this test is trying to examine. And what we found when we did this forced swim test is that pubertal LPS treatment induced depression-like behaviors in females only. So we didn't see this effect in males, but we did see it in females. So when comparing the duration of immobility, we saw that mice treated with LPS during puberty showed significantly more immobility than saline controls, suggesting that pubertal LPS treatment does induce depression-like behaviors in females, right? So this is what I've been discussing in this presentation. The fact that we gave pubertal mice a chronic stressor actually caused depression-like behaviors later on in life when these female mice, in this case, reached adulthood. Another test is the elevated plus maze, which is a test for anxiety-like behaviors. And there is also the open field test, which once again is a test for anxiety-like behaviors. So this is a test that we also did, and once again, it's really just to measure anxiety. When we talk about the elevated plus maze, more time in the open arms is associated with less anxiety. So if we look at this picture, you have a section of the maze that is open with no arms, and then you have a section of the maze which is closed with the arms blocking it off. So the idea is if the mice spend more time in the open region of the maze, this is considered to have less anxiety behaviors, and if they spend more time in the closed arm portion of the maze, this is considered that they have increased anxiety-like behaviors, right? If they are in the open arms, they are more willing to explore. That is the idea. And the same thing applies to the open field test. If mice spend more time in the center, this is considered that they have less anxiety-like behaviors. And if they spend more time in the perimeter of the open field arena, this is considered as them having greater anxiety-like behaviors, right? And once again, it's the same thing. It's the idea that they are either more willing or less willing to explore, which is thought to be an indication of anxiety in mice. So what we found with these anxiety tests in mice is that pubertal LPS treatment does not induce anxiety-like behaviors in females. So on the elevated plus maze, we see that there is no difference in terms of time in the open arms between the mice treated with LPS in puberty and the mice treated with saline in puberty. And the same thing applied for the open field test. There is no difference between the female mice in how long they spent in the inner zone of the open field arena, right? Those treated with LPS and those treated with saline show very similar times in the inner zone. So this indicates that the female mice treated with this bacterial infection in puberty do not develop anxiety-like behaviors, but they do develop depression-like behaviors. So we're seeing some sex differences here, because when we go on to the male mice, we saw that pubertal LPS treatment induces anxiety-like behaviors in males, right? So compared to the saline controls, males treated with LPS during puberty spent less time in the open arm of the elevated plus maze and in the inner zone of the open field arena, suggesting that pubertal LPS treatment induces anxiety-like behaviors in the males, right? So, in conclusion, we see that pubertal LPS treatment induces depression-like behaviors in females and anxiety-like behaviors in males in adulthood. So this is quite interesting. Not only is puberty a sensitive period of development, but it affects males and females in a different manner in terms of the mental health problems that may be developed later in life. And we also saw that there was no behavioral alterations were observed in adult male and female mice. So once again, it's just emphasizing the point that puberty is an extremely sensitive period of development. If the bacterial infection is given during adulthood, we do not see these behavioral deficits. We do not see this induction of anxiety and depression like behaviors. We only see this if the chronic stressor is given during puberty. So, what could be the potential causes? In terms of the age differences, pubertal mice, when we give pubertal mice LPS, we actually see that they have a hyporesponsive response to stress, meaning that they show less of a stress response in response to the stressor. And the idea here is that they may not be developed enough to show an appropriate stress response. Once again, as I've said, puberty is a time of development. So their HPA axis, as I mentioned previously in this presentation, may not be developed enough, and they're not showing the proper stress response. And as a function of this might make these mice more susceptible to mental health problems later on in life. And in terms of the sex differences, right? So just to make you guys all remember, we saw that male mice showed anxiety-like behaviors but not depression-like behaviors, and female mice showed depression-like behaviors but not anxiety-like behaviors. And a potential explanation for this could just be the different levels of circulating gonadal hormones. Estrogen and testosterone have different effects on the immune system, right? So the fact that male and female mice have different levels of estrogen and testosterone may explain, or maybe one possible explanation as to why we're seeing sex differences in terms of the mental health problems that might be developed. Another potential explanation or determinator in how we respond to stress is the gut-brain axis, because we know that there is a bidirectional communication between the gut and the brain, and the microorganisms in our gut can influence stress and immune responses. So a lot of our research concentrates on how the gut microbiome can be beneficially changed, for example, with probiotics, which I will discuss a little bit more later on, which can then prevent the occurrence of depression and anxiety for those who experience stressful early life experiences. So this is the main point of our research. We want to determine what exactly is making these pubertal mice more susceptible to developmental health problems, and one potential explanation for this could be the gut microbiome. What we eat and the bacteria, the microorganisms that reside within our gut microbiome can have a profound impact on our brain functioning and the likelihood of us developing specific mental health problems later on in life, right? So this brings me to my other point, is what can be done to reduce the effects of stress. So one potential thing that can be done to reduce the effects of stress, especially during puberty, is the use of probiotics. Probiotics are live microorganisms promoted with claims that they provide health benefits when consumed, generally by improving or restoring the gut flora, right? So as I previously discussed, We are pretty certain that the gut microbiome can have a really profound effect on the brain and how it develops. So if we replace the microorganisms and the bacteria in our gut microbiome with more beneficial ones through the use of probiotics, and probiotics can include things, for example, such as kefir, which is present in a lot of yogurts. So that's just to give you all an example. But if we actually consume this, this may increase the beneficial bacteria within our gut and may help us reduce the effects of stress on mental health later on in life. Another way that stress can be dealt with, or with which we can cope with stress, is through acknowledgement and acceptance. One of the most powerful tools we have is our perspective. So this is something that I mentioned earlier on in the presentation, but especially when it comes to stress, stress is highly subjective, and how we perceive stress and how we decide to deal with stress can have a profound impact on the actual effects that it has on us now and in the future, right? So when anxiety and depression talk, you should listen. You are feeling a certain way. You are not anxious. You are not depressed. You are feeling this way. And what I mean by this is that you are not a depressed individual. You are just feeling this way, and this is something that can be changed with time. Recognize that you are really feeling anxious and depressed. Don't be ashamed for feeling this way. There is nothing wrong with feeling anxious or depressed. Nobody knows the circumstances that you went through, and other individuals can try to help you. There is no reason that you should be ashamed. If you are ashamed, this can only make the problem worse. You need to accept that these feelings are okay and acknowledge that anyone else, given your experiences, would feel the exact same way. Another way that we can deal or cope with stress is through perspective changing. So two great ways to do this would be through mindfulness and meditation. They are really great ways to change perspective. And the main idea between these two things is to be present in the moment, not thinking about the future or past, right? When it comes to mindfulness, it forces us to stop reacting to our environment, consciously observe without valence. Force yourself out of your reactivity pattern, autopilot, see life through your eyes presently, right? So as I said, the real idea here is to just be present, observe the world around you, the beauty around you, not thinking about all the other problems that you may have encountered in the past or the problems that you think you're going to encounter in the future. Just be present in the moment. And the same thing applies for meditation. Meditation is basically a focused form of mindfulness. It can either take 2 minutes or 2 hours, and it is usually accompanied with mantras, sounds, and voices. It can be done in a Buddhist temple, or it can be done around town. It can even be done in your living room. And it's really the same idea as mindfulness. It's just to be present in the moment, not thinking about anything else around you. These are really effective ways in coping with stress. And most of the time, with the beautiful technological advances that we have, you can find applications that actually do mindfulness and meditation in a very effective manner. They show you how this can be done. The last thing that I would like to discuss is coping strategies. So the first coping strategy would be to find a balance. Stay tuned in, but know when to take a breather. Unplug. It's basically, this can be done through mindfulness and meditation. It's just the idea that you could stay tuned into the present moment, not the past, not the future. Concentrate on what you can control. You can do something that you enjoy. When we do things that we enjoy, we oftentimes forget about the problems that we may have encountered. Deal with problems in a structured way. There is no use of trying to deal with a problem without a plan. Doing this will only increase your stress levels. Create a plan step by step, describing how you will deal with this problem, and just by having this plan in of itself will help with your stress. Another important coping strategies in general is to stay healthy, eat healthy, avoid substance use, moderate caffeine intake, get proper rest and sleep. When individuals experience stress, they oftentimes forget about their health and they start using substances, they start increasing their caffeine intake, they get less sleep and rest. This will only make your stress worse. It is important to keep your body healthy, stay active, keeping yourself active will definitely help with stress. And the most important coping strategy is to communicate with loved ones. Communicating with others will certainly help with your stress, making them understand what you're going through, and just having that discussion with them will for sure help with any stressful circumstance that you might be dealing with. So, thank you all for listening to my presentation. I will be happy to answer any and all questions that you might have for me.